My name is HAMDOON SYED. I am a medical imaging technologist and a senior sonographer, as well as a tutor at Kibulim Health Training Schools. Good morning, class. So you're most welcome to the ultrasound class. We're going to look at protocols of scanning the liver and sonographic liver anatomy. The liver is one of the largest solid organs in the body, okay? And for you to be able to successfully scan the liver, you should appreciate its true anatomical location. All right? The liver has a broad range of physiological functions with over 500 roles. Okay? The liver weighs around 1.6 kilos in men and 1.4 kilos in the female. Okay? So we are going to look at ultrasound of the liver, its protocols, and the anatomy. So the word ultrasound means high-pitched sound that is beyond the audible range of the human ear. Okay? So what happens is that when ultrasound is sent into the human body, the echo is reflected back from the internal organs, and based on the stiffness of the internal organs, the stronger the reflected echo. For example, if the ultrasound beam strikes the bone within the body, the reflection of the sound will be stronger, and therefore the image will appear brighter. Is that okay?
Yes.
And when the sound beam goes through fluid, there will be no reflection of sound, so it will appear black. Okay? And when the ultrasound travels through organs like the liver, which is a soft tissue, the reflection of the sound will give you a gray image. Okay? A grayscale image. So let us look at the anatomical location of the liver. Okay, so I'm going to use the model here to demonstrate to you where the liver is located. Yes. Is that okay?
Yes.
So when you look at our colleague here, X, this is the anterior abdominal wall. Okay, the abdominal cavity is divided into 4 cavities. Okay, so the liver, bulk of the liver is located in the right upper quadrant. So when we are looking at the protocols for scanning the liver, we use 3 key important windows to access the liver. We look at the subxymphoid window, okay, just below the xymphoid process. Okay, we scan through the subcostal window. This is the costal cartilage here. Scan through the costal window, and then we scan through the intercostal window between the bones. Remember, ultrasound does not go through bones, it goes through the soft tissue. So we scan through the intercostal window to access the liver. Is that okay? Yes. Those are the 3 key important windows. So when we open up, what are we expected to see? So when we open up the anterior abdominal wall, we appreciate the internal organs. We said that the bulk of the liver is located in the right upper quadrant. Okay, that's good. So this is our liver here. Okay, we have the left lobe of the liver, and then we have the right lobe of the liver. The liver is divided anatomically by the falciform ligament. Okay, and then you see this green structure peeping here. Yes. This is the gallbladder. Okay. So after you have appreciated the anatomical location of the liver, you can now comfortably locate it when you're doing the ultrasound. Okay, welcome class to the practical area now. You remember from the demonstration that we did in the skills area, we divided our quadrant into 4, right? And then we have our right upper quadrant here, and we saw that we have our liver within this region. Is that okay? Yes. So make sure that whenever you have a patient for scan, you have to explain to them the procedure that you're going to do. Make sure you obtain verbal consent, okay? Yes. And make sure you cover them appropriately with draping, okay? Yes. In that you do not weight the patient's clothes with gel, okay? So when all that protocol is observed, on the ultrasound machine, you have to enter the patient data. Okay. So we are going to enter the patient data, which is very, very important. Okay. You enter the age of the patient. Okay.
Yes.
You have to select on the protocol. Okay, we have OBS, we have gyne, we have abdomen. Okay, so you must select the protocol for abdomen because we're going to look at the liver which is in the abdomen. Is that okay? Make sure you state the gender. Okay, appropriate gender, the male patient. Thereafter you start the exam. All right, so when you're going to start the exam, you have to apply the coupling agent. This is called a coupling agent or an ultrasound gel. Okay, this gel is applied onto the body of the patient. The gel helps in transmission of sound into the body of the patient. When you do not apply gel, the sound will not be transmitted into the patient and you will not be able to acquire images. Thereafter, you use your convex probe. Okay, this is a convex probe. Why convex? Because of the surface. The surface is convex. Okay, so we use a convex probe to scan the liver. All right, so we looked at the three windows: the subsymphoid window, okay, the subcostal window, all right, and then the intercostal window between the ribs. Is that okay? Good. So to start with, since the liver is the largest solid organ in the body, you have to adjust the image quality based on the liver. Okay. So to adjust image quality, we use the TGC gains. Okay. The TGC gains strengthen the echo from superficial to deep. Okay. In other words, the image that you're seeing should appear homogeneous. Homogeneous meaning that the image quality that is up here should be equal to the image quality down here. Okay, so that is called adjustment of the TGC gains to ensure homogeneity of the image. This is our liver tissue here. Okay, so when I go to the subcostal window, we said we shall appreciate the anatomy. Okay, we have our left lobe here, this triangular appearing structure that you see. This is the left lobe. Okay, and you are seeing that the images are grayscale images because the liver is soft tissue. Okay, remember we talked about image appearing black. That is because when sound goes through fluid, it is not reflected back. Okay, and sound is being reflected through the liver tissue, and that's why you get a gray image. All right, so this is our left lobe of the liver. Okay, from the subsymphoid window. Then I come to the subcostal window here, taking a deep breath. Okay, this is through the subcostal window. You can see you have a big view of the liver. Okay, this bright structure that you see here, this is the hemidiaphragm. It appears bright because sound is being reflected. It's being bounced off from here back. Okay, breathe out, breathe normally. Good. So the breathing technique helps you to push the liver out of the rib cage. Okay, in that you can have a broader view of the liver. All right, so still this is the intercostal window. When you go into the intercostal window, you appreciate the liver much more clearly. Okay,
Yes.
now within the liver, it is intersecting, or it has got structures that are traversing it. You see these round black structures,
Yes.
this black, that these are the hepatic veins. Okay, and you see these structures which have a bright outline, these are the portal vessels. Okay, the portal vessels appear bright because it has a connective tissue around it. Okay, all right, good. You see this black structure here that is pear shaped. Okay, this is our gallbladder that is filled with bile. Okay, make a stomach big. Okay, good. Remember, when you're looking at the liver, the measurement of the liver is very important. Okay, we measure the liver at the mid-clavicular line. Okay, once you have your liver at the mid-clavicular line, you take the longest dimension to the diaphragm there. Okay, so his liver is measuring 15 centimeters. Okay, that is one of the protocols that you must follow to measure the liver. Is that okay? So still through the subpostal window, we must appreciate the liver hilar here, and this tubular structure that you see entering into the liver, it is the portal vein. Okay, entering at the hilum. When you put color Doppler demonstrates flow. You see that? That is blood flowing through the portal vein. Okay, good. So some more few structure that we can look at here. We are done with the protocol of the liver, how you access the liver. Okay, when you get a section through the portal hilar, we have the portal vein here, we have the CBD, that is the common bile duct, and then we have the hepatic artery proper here. All right, so this appearance gives you a Mickey Mouse appearance, like a face, 2 eyes and a mouth, right? Yes. Yeah, so that's called a Mickey Mouse sign. Is that okay? Yes. Good. And then you see this bright line here? This is the falciform ligament. Okay, these are internal structures. Falciform ligament, this is the caudate lobe. Okay, and then we have the IVC posteriorly here located. Is that okay? Then when we have taken a deep breath and hold, when we do an uppercut, we have important structures here. This is the middle hepatic vein, and then is the left hepatic vein draining into the IVC. Okay, and then this is the right hepatic vein here. Okay, so we have 3 hepatic veins draining into the IVC. Is that okay? Yes. Then we have the ligamentum teres here, this bright structure, ligamentum teres. All right, so these are some of the structures within the liver. Okay, you're able to acquire them when you follow the protocol strictly. If you do not follow the protocol, if you look in the wrong area, you will not be able to appreciate the liver. Is that all right, class? Yes. All right, have you understood the protocol? Yes. Oh, okay, good, thank you. What we have been looking at today was the protocol for ultrasound scan of the liver. The liver is one of the key organs of the body that is affected by various pathologies and is a key interest for various medical professionals, and ultrasound helps in diagnosing and guiding the doctors to the right line of treatment, and as such it is very, very important for the students and the professionals to rightly access the liver and appreciate the anatomy of the liver and be able to diagnose the pathology of the liver. And this helps the doctors to come up with a diagnosis and appropriate treatment for the patient.